Brought to you by the medical professionals at Carpal Pain Solutions, developers of the Carpal RX.
Many people who have carpal tunnel syndrome believe that having surgery is a way to cure their condition. But the fact is, carpal tunnel syndrome is a disease that doesn't have a cure. So even though you can't cure it, you can manage it. And surgery is one of the ways to manage carpal tunnel syndrome. But it's not the only way. There are other extremely effective ways in treating this condition that don't require surgery. So if you have hand pain from carpal tunnel syndrome, discuss with your doctor what those non-surgical treatments are. Your doctor should tell you that more than half of the people who have surgery for carpal tunnel syndrome are dissatisfied with their results, while the overwhelming majority of non-surgical therapy users are quite satisfied with their results. So much so that the major medical organizations advise patients to use all non-surgical options before considering surgery. So what are these non-surgical therapy options? They basically fall into three categories: rest, splinting especially at night, and deep tissue massage of the wrist and forearm. In fact, deep tissue massage is nearly 100% effective in relieving carpal tunnel syndrome, but only if it's done daily and for a period of 2 to 4 weeks. But this isn't your everyday massage. It requires specific motions on the wrist and forearm that over time will drain excess fluid, break up adhesions, and enlarge the carpal tunnel. This reduces inflammation, thus alleviating carpal tunnel syndrome. So as you see, you don't need surgery to treat your carpal tunnel syndrome. When you see your doctor, remember to discuss the fact that the great majority of people who have carpal tunnel surgery are dissatisfied with their results, but the vast majority of people who have non-surgical therapy are quite satisfied. Your doctor should candidly and openly inform you of this, because those statistics are so important that the Association of Orthopedic Surgeons and the National Institutes of Health recommend that all patients try all non-surgical options before considering surgery. Once again, those non-surgical treatments that everyone should use first are resting your hand, splinting, especially at night, and deep tissue massage, which is almost 100% effective in relieving symptoms. But it must be applied professionally and every day for at least 2 to 4 weeks. Anything less or improperly applied is useless. And to get professional and effective deep tissue massage therapy for your carpal tunnel syndrome, you don't have to visit a therapist every day. Instead, the Carpal RX will give you the same therapy at home. If you have carpal tunnel syndrome, you owe it to yourself to try this remarkable product and take advantage of the 60-day free trial offer with every Carpal RX. If the Carpal RX doesn't relieve your symptoms, or if you just don't like it for any reason, return it for a full refund, including all of your shipping costs. The Carpal RX was specifically designed to treat the wrist and forearm. It works just like a therapist's fingers that are treating you for carpal tunnel syndrome, except it treats you every day and at a fraction of the cost of a therapist. The Carpal RX automatically produces the same motions that a therapist uses to relieve pain and other symptoms. And it's so simple to use. Just plug it in, slide it on, and strap it in. Then relax. The Carpal RX will do the rest. The Carpal RX always has a 60-day free trial, so if you're not completely satisfied with your results, return it for a 100% refund, including all your shipping costs. The Carpal RX is guaranteed to permanently and easily get rid of carpal tunnel syndrome, as well as wrist tendonitis and repetitive strain injury. Visit the Carpal RX at carpalrx.com.